And with the rise in coronavirus cases, doctors say they're seeing a decrease in the amount of people seeking emergency non-COVID treatment at hospitals. That's especially concerning for people who may be experiencing a heart attack or a stroke. CBS 4 anchor Marybel Rodriguez has the warning from doctors.
The estimates are somewhere between 30 to 40% less patient numbers than we usually would see.
The reason being, many people are afraid to go to the hospital for the fear of possibly contracting the disease there. However, Dr. Ivette Motola, medical director for Advanced Stroke Life Support Program at the University of Miami Miller School of Medicine, says the consequences could be much worse.
We understand their concerns, but the risk of getting COVID from coming to the hospital with an emergency condition pales in comparison to having a catastrophic stroke or heart attack and not being able to get treatment for that.
Dr. Motola says especially patients who are suffering a stroke or a heart attack, time is of the essence.
The longer people take to come in and get treatment, then the less there is that we can do for them. And the ultimate impact is the difference between someone completely recovering from something that can be really devastating or having a severe disability or even dying from it.
So what are the signs you should look out for in the event of a stroke? Dr. Motola says remember the acronym B FAST. B for a sudden loss of balance. E for eyes, trouble seeing out of one or both eyes. F for face, any facial weakness or an uneven smile. A for arm weakness. S for slurred speech. And T for time. Call 911 right away.
People should call 911, as opposed to driving themselves to the hospital. This is for multiple different reasons. One, the dispatchers and fire rescue and EMS are equipped to start treating the patients, detecting what's going on, and bringing them to the best, closest appropriate facility, whatever that hospital is. And they also notify the hospitals. And if they call 911, they don't have to worry about things like masks themselves. The EMS folks will be able to have those for them, and they themselves, of course, are wearing appropriate personal protective equipment.
And also, once a patient arrives at the hospital, they will be tested for COVID and kept separately. Dr. Motola also mentioned most of the time patients may not realize they are having a stroke. It's usually detected by family, friends, or even bystanders. Marybel Rodriguez, CBS 4 News.